Hi, and this is Ask Pointzy. It's 6 o'clock once a month. We're going to do this Ask Pointzy live. Now, I had some great feedback from the last time that I did a live. And interestingly, the feedback is they liked me, the husband was out. So it's just me tonight. I hope everybody's happy with that. I preferred my husband in it because it gave me a bit of somebody to bounce off, but hey ho. So first and foremost, it's Mothering Sunday today in the UK. So I would like to wish everybody out there that happens to be a motherly figure in whatever capacity you are, whether that is a birth mum, biological mum, whether that's a surrogate mum, whether that's a actual mum, a step mum, an aunt, a godmother, a sisterly figure, a mentor, a foster mum, or whatever type of mum you may be, whatever motherly figure you are, I wish you a very happy Mother's Day. And I'm just watching my cat in the background who knows he shouldn't be on that side. Buddha! Buddha! You shouldn't be on there. You know that. Excuse me while I put my cat out who's not behaving. Oh, this cat is huge. Go on, in there. Okay, so unlike last time, I've been asking patients all week for some ideas on questions of what they might like to have answered. And interestingly, we have actually got 3 questions this time. So the first question was on hypothyroidism and acupuncture. And it brought us on to a different subject, which I'm going to explain in a little while. So, can acupuncture help with hypothyroidism? Yes, it can help to manage the symptoms of hypothyroidism, which is low thyroid. Now, when we say hypothyroidism, it doesn't necessarily mean it always comes from your thyroid. It can come from your brain. Or it can come from a secondary condition that's making your thyroid levels low. So it's an entire cascading situation. Thyroid function originates starting with the TSH, which is in your pituitary gland at the top of your head, your hypothalamus and your pituitary. What happens then is that sends a hormone called TSH. T for telephone, S for sexual, H for hormone. And it's actually thyroid stimulating hormone. And what that's doing is it's sending that signal to your thyroid. And it's telling your thyroid to create hormones. Specifically, it would tell it to create T3, which then converts to T4. T4 then converts to T3. So that's where you get that T4 TSH from. So when they normally do your blood test, they'll go, yeah, your T4 is good. That means your pituitary glands, your thyroid's good. And they'll test your TSH, and that means your pituitary gland's good. Does that mean that if your T4 and your TSH are both okay, does that mean you don't have symptoms? No. You can still have symptoms even though both of those blood tests are within normal limits, because there's also the T3 that needs to be checked, and quite often they're not on blood tests. So we would often say if you're going to do a thyroid panel, you need to check for T4, T3, TSH, and sometimes testosterone as well. Now, these are the other aspects that the thyroid function. Medications can interact with the level of hormones that the thyroid produces without damaging your thyroid. So your thyroid could be perfectly fine. Your pituitary gland could be perfectly fine. They're both communicating great. You could be taking a medication that's lowering the other hormones. Equally, you could have a diet that's increasing those hormones, yet they're all working perfectly fine. So it isn't an open and closed shut case of that blood test perfectly normal. You have to sometimes look at the symptomology and see, are they more on the borderline of normal? And is there any extinguishing factors? Is there any medications? Is there other conditions that could be affecting it? Now, my question was straight at the beginning, can acupuncture help? Well, the question is how? In Chinese medicine, an awful lot of hypothyroidism is known as a pattern called spleen qi deficiency or spleen yang deficiency, not linked to the Western organ, it's the Chinese meridian. So we would treat that, and what we find is that that helps to smooth over the overall, it smooths over the symptoms. So what you'll find is that it's going to help with regulating your energy, it's going to help with your temperature. You may be finding that you have something called the 3 p.m. crash. So you do perfectly fine. You get to 3 p.m. and you are completely and utterly depleted. You have got no energy whatsoever. And you just feel, ugh. And you need a pick-me-up. Coffee and a biscuit, a bit of sugar. It'll be sugar you specifically want. Cakes, biscuits, chocolate, anything to try and get sugar and glucose back into you, especially between the hours of 1 and 4. They're the hours, and we tend to say it's a 3 p.m. crash. That can be a big indicator as well that something might be going on with your thyroid if it's only in the afternoons you're struggling more. We also find that people with hypothyroidism have problems with their sleep. They have problems with their emotions. They often have hormonal issues, especially menstrual difficulties with heavy blood flow, anemia, prolonged periods, and just can't regulate those hormones at all, because thyroid plays a function in female-related hormones. It also plays a function in male-related hormones, and for a lot of them, they can find that their libido drops. Now, libido means their sex drive. They just don't really, not in the mood for it, which can be a bit difficult for them because they don't know why they're not really in the mood for it. They're just not fussed. And you'll also find that they often find people with hypothyroidism often feel a lot more cold. Now, if you're feeling more cold, you're kind of be wanting to try and warm up. Now, cold is going to lead to achy muscles, which is going to flare your arthritis, your achy joints, your cramps, spasms, things like that. All of that then is going to have a knock-on effect as well. So the acupuncture helps all of those symptoms. And we look at trying to find your cause for your thyroid problem and see if we can help it from that way. But can it cure the thyroid? No. Can it cure the pituitary? No. But it can help to ease the symptoms that they may be causing or that a drop in those hormones may be causing. Equally, what we have found with acupuncture is that it can really help because a lot of people with hypothyroidism have problems with diabetes type 2 and also they have a problem with hypertension. So again, it's making a difference on them. Now, I said there was another aspect I wanted to talk about. Postnatal depression or baby blues. When a woman goes through pregnancy, her thyroid function really, really drops. Now, when I say drop, I mean plummet, especially post-birth, especially if there's blood loss and problems like that. And it can lead to problems with those emotions. More tearful, more low mood, more depressed, more feeling cold, lack of energy, can't sleep. And that, of course, when you can't sleep and you've got a newborn baby, you already are going to struggle left, right, and centre. That's going to lower your mood even further. If you are a new mum and you are struggling greatly and thinking, I might have postnatal depression, before you start taking antidepressants, you might want to just ask them to give you a quick blood test to double check it isn't your thyroid. And you may have to point out to them that you are postnatal. Now, remember, postnatal can be anywhere up to 6 months after you've had that baby for your thyroid side of it, because if you haven't taken something to boost that thyroid back, you're constantly in the doghouse with it, especially if you're breastfeeding. When you're breastfeeding, that is going to drag those thyroid hormones down even more. So again, it's very vital that you do check whether or not you're having issues with your thyroid function after you've had a baby. And if it is the thyroid, start treatment immediately. It's vital that you get that back because that's a big step in getting you back. And if you know anybody that's having a baby or had a baby, please let them know this information. It's vital. It's medical information that's out there anyway, but people don't always know it. And it is important to know. It's number one for me. If a woman comes in and tells me they've got postnatal depression, my first question is, did you get your thyroid checked? And they 9 times out of 10 go, no, nobody told me to check my thyroid. And we start going through, can't lose weight, losing hair, brittle nails, tired, not coping well, struggling to sleep when they can sleep, and then they're too tired and they just can't think straight. Baby brain, brain fog, muscle aches. And it's quite often, I've had quite a few patients and it's turned out to be a thyroid issue. And they've had, now in a couple of cases, it has been genuine postnatal depression and they have needed therapy and they've needed some help with antidepressants short term. But a lot of them have turned out to be something else that's just been overlooked. So it is always a good idea to go and check to see if you have a thyroid issue. So the next question I got asked then, and it's a really interesting one, is about a treatment that I offer called MLD. And it's a form of massage, manual lymphatic drainage massage. So this is a specialist massage to treat the lymphatic system. Now, most people have heard, well, I'd hope they've heard of something called lymphedema. Lymphedema is where you get an awful lot of inflammation around the body. It tends to link mostly in the legs, also in the arms, and you can get it around the abdomen. But what we find is that you also have problems with lipidemia sometimes. Other people have had that condition. Inflammation can become a problem for other conditions when there's been cancer and they've had lymph nodes removed. That can cause a problem. I found a few patients that they need an all-body treatment and acupuncture is too strong for them, especially things like fibromyalgia and lupus, things like that. Their body is riddled with inflammation and even the acupuncture just wipes them out. I've tried a few times and some patients really respond, but some it's just too strong. So how can we help them? Well, that's exactly what MLD does. It kind of detoxifies the entire body, getting the circulatory system and the lymphatic system moving in one fell swoop. And it just like washes through the whole lot, getting all of it cleared. Our lymphatic system doesn't have a pump. Now, our circulatory system does. It has a heart, and then it has the veins and the arteries, and that's how all the blood moves around the body. And we know that if you don't get a good blood flow, we get cold limbs and blue and tingles and all the rest of it. But what happens if you don't get a good lymphatic flow? Now, the problem we get is when we're in pain, we don't move much. So you've got inflammation in the joints, you're not going to move. When you don't move much, the problem you have is that nothing in your lymphatic system is moving much too, which increases the inflammation, which then just gets clogged in your lymphatic ducts and it just stays there. Well, that's no use to anybody. What the manual lymphatic drainage does is move it from one duct to the next gland and onwards and onwards. And it's to get it back up to the top of the chest where we can drain it. It's fantastic. It does make you urinate an awful lot afterwards. But if you've been having issues with your bladder, with constipation, with muscle aches, with poor circulation, not being able to move very well, swelling, especially swelling in those legs, arms, post-surgical, anything like that, manual lymphatic drainage, it's done over clothing. And it's not movements like this. This is a massage. It's a nice, gentle, flowy. And for deep tissue, we do a lot of this movement. And we're going in really deep where you can see the muscles moving. Manual lymphatic drainage is done over clothing at strategic spots. And it's gentle. Can you see the movement that we're doing? It's like a pumping action. And what we're doing is pumping at strategic spots all over the body, using the ducts and clearing the glands. And what we do is we do that in 2 cycles. The first cycle unblocks and the second cycle gets it moving. It's a fantastic, gentle treatment. It takes about an hour in total, and patients have found they sleep like a kitten. Even my fibro patients sleep like a kitten. My lupus patients have found a major difference in their aches and their tiredness. And a couple of them have been bug-free, touch wood, for a while, you know, so it's making a difference to them as well. It is much, much more gentle than acupuncture, reflexology, and any other form of massage. And the only thing you have to remove is your shoes. That's it. Anybody of any age can have it. It doesn't matter if you've got low blood glucose, even active cancer, because we treat oncology with it. The only thing is that depending on where your cancer is, we may have to make some adaptations, and sometimes we do have to talk to your oncologist just to make sure with your medications and things, chemo, radiation, you know, we've got to make sure what we're moving first. But it's a fantastic treatment and really, really does benefit an awful lot of patients. So on to that, with massage, I had a patient recently ask me why they couldn't just come and have massage with me after they'd been on holiday. And a lot of people will go, yeah, well, you know, it's just a holiday. It's no biggie, you know, I can understand it. I wouldn't give that patient massage for a minimum of 14 days after they'd landed. It was a long haul flight. And that patient had some what we call red flags for DVTs. So they were already a smoker, they were slightly overweight, there was a family history of DVT, they had poor blood circulation already, and they'd just been on a long haul flight where they were on holiday for 7 days and then on another long haul flight all the way back to the UK, which is a standard. A lot of people do it. And then they wanted to come and have massage me, and I said, not for a minimum of 14 days. And they went, but why? I can have a massage while I was on holiday. We'll discuss that one in a second. Anyhow, I will not massage anyone for a minimum of 7, 10, 14, and sometimes even up to 21 days post-landing, depending on their individual DVT risk and how long they were on the plane. And people think, but why? Going on an aeroplane, especially long-haul flights, your legs don't move very much. Your body doesn't move very much. You're normally squeezed into these tiny little things. And sometimes you're lucky and get some foot space. But most of the time, we're not. And a lot of people don't wear the flight socks. They don't realise they need them. They don't wear them correctly. They put them on at the wrong time. They take them off at the wrong time. There's so many issues because there's not a lot of education out there about this. But the one thing that we know as therapists is that massage moves blood. It can dislodge a blood clot, and it could cause a portion of that blood clot to break away. If it breaks away, it's going to travel anywhere that we're massaging. Now, if we're just doing a nice gentle back massage, it's not so bad. What if we're massaging those legs? That's normally where the blood clots start. And we're massaging those legs. And the logic is when you massage somebody's legs is you always massage it down and then you massage it up because you want the blood flow to return to the body. So we've just dislodged it as we go down and then we're pushing it back up towards the body. That's dangerous. Not a good idea. Acupuncture equally moves blood and therefore could do a similar problem. Not happening on my watch. There are many practitioners that don't even realise there is that. They will have been trained in their training. I really, really hope they were trained in their training. But the trouble is, that was all it was, training. They didn't really take it on board. Now, in foreign countries, the training's often different for massage therapists. They don't always train on this. It depends what level of training they have. Technically, should they be massaging anybody's legs after they have just got off an aeroplane. What do you think? I know what I think. Having an upper body massage would be perfectly acceptable, but I wouldn't go past the buttocks, because anything beneath that, you don't know what their DVT risk is. And there's a lot of them in these hotels and things and back streets and what have you in other countries. They do get you to sign a waiver that covers their ass. It doesn't cover yours. That's making sure that you can't sue them, because somewhere hidden in there will be about a DVT risk and you've signed their waiver. So think about it when you're in these other countries. If you are an increased risk for DVT, and do remember oral contraceptives, smoking, things like that can increase your risk. There's quite a few things. HRT has question mark, but it's normally with oral. What you need to know is that if you are over the age of 60, you are of lack of movement, you have had recent injury or surgery specifically to the abdomen or lower body, if you are pregnancy or recently given birth, and when they say recently, they mean within 3 months, especially if there was a cesarean involved, 100% if there was a cesarean involved. If you are on an oral contraceptive, so we're not talking IUDs and if you've got coils and things, we're talking oral tablets or oral HRT. So your patches are fine. It's the oral contraceptives that increase the risk. Being overweight or obese, I'm sorry guys, but that is true. The bigger you are, the lower the circulation in your body, the increased risk for DVT. Smoking is a huge DVT risk, including vaping. Don't think, oh, well, I don't smoke, I vape, so it's fine. No, if you are a vapor, you have an increased risk for DVT. And obviously, any history of cancer can be an increased risk for DVT as well. So there is quite a bit there for you to bear that in mind. Now, if you've got half a dozen of those things in one body, you might want to really, really think about whether or not you have a massage abroad. There are a couple of other things as well. Just so you know, there is ulcerative colitis, there is inflammatory bowel disease, Crohn's disease, and heart failure. If you have anything in those, and of course, the last one always will be a family history. There are some people that are genetically disposed to having DVT risk. It's the V factor. I never remember that one. So that's why I did have to look that one up. So it's one of those things. And some people have none of those risk factors and randomly have a DVT. Just boom, out of the blue. It's like, where the bloody hell did that come from? I'm perfectly healthy. I am not obese. I'm not even overweight. I don't smoke. I don't drink. I don't take any medications. No oral contraceptives. There is no family history. There is no inflammatory diseases. There is no autoimmune diseases. I have no circulatory diseases. And boom, they have it. These things can happen just randomly. We do know that some people were triggered by the AstraZeneca jab. It's horrible to say, but, you know, randomly, they'd had their COVID vaccine, it was AstraZeneca, and bam, there they were having them. It's one of those things. So one of the things you need to be aware of is risk factors. And if you are flying, it is one of the big risks. So just enjoy your holiday, but maybe think twice. If you're wanting that massage, don't let them go past your buttocks, because that reduces your risk. Back massage is great. You don't need that full body. You don't need those legs doing. If obviously you do, I mean, I suppose the best thing to do is to know what are the symptoms then of a DVT. Well, the number one is a weird leg swelling. And normally you'll get it in the calf. It's normally right at the back of the calf in the middle, in the meatier bit, you know, not far behind your knee. But it can go all the way down closer to the ankle, but it's normally somewhere in the middle, closer to the knee. And what you'll normally find is that it'll feel tight, like it's kind of like somebody is squeezing it, but from the inside. And it will get tighter and tighter, and you'll want to massage it out, and it'll hurt. You may find some swelling, not always. In the earlier stages, you don't always find swelling. And you may find that when you put the back of your hand, never feel it with the front of your hand, always feel with the back of your hand. So when you feel the back of your hand to the skin, it may be very warm to touch. You feel the front of your leg and it's cold. You feel the back of your leg and it's warm, and warm in one area. There may be a little redness there, or the skin may look a bit pink or purple. Skin changes like that, you want to go and get them checked out. Other than that, keep active, keep your legs moving. If you're on a flight, try and get some leg room, keep those legs moving, get up and go to the toilet, just get up if you can, and use your flight stocks appropriately. And if you're having acupuncture or you're having massage and you're coming to see me and you've been on a flight, please do let me know prior to your appointment. Don't be surprised if I may say, we need to move your appointment. It is quite normal for me to do that. So hopefully that's helped somebody on knowing the risks on massage, MLD and acupuncture. The only other question I got asked, let me have a look at what was my third question that I got asked. DVT, MLD. That was it. Whether or not somebody could be having I had a patient recently, and what had happened is they'd come in and they told me they were perimenopausal, having problems with their periods and really couldn't get on top of them. And through investigation and questions, I found out that they'd recently had a child. And when I say recently, it was a couple of years. But they were what, I hate the term, but it's called geriatric mother, meaning anybody over the age of 35 that happens to get pregnant. So this person was what we call a geriatric mother. They'd had a baby later into life, and then they breastfed for a prolonged period of time. Now we're talking 15 to 18 months. And their periods hadn't come back. Not properly. And that's quite normal. Your periods will go funny after having a baby. And if you breastfeed, they can also kind of stay away. And then when they finally do come back, it takes a while for them to settle down. It's called post-lactation amenorrhea. They even have names for it. But when this person went to the doctor, they didn't put two and two together because they'd already finished breastfeeding. And this was now a year after the breastfeeding. The kid's nearly 3 years old, 4 years old, and they're still having problems with their period. So at this point, they toddle off to the doctors and say, I'm having problems. My periods are all over the place. They haven't settled down. My hormones are all over the place. What's going on? And the doctor said, well, you've got perimenopause based on their age. Not thinking about that geriatric birth that she had and the post-lactation. Didn't even really ask. So if you are perimenopausal, come get some acupuncture. We can help you out. But equally, if you are somebody who is pregnant, post-pregnancy, lactating or just finished lactating or finished lactating within the last year, the longer you lactated, the longer you breastfed, the more messed up it and longer it may take for your periods to re-establish, which can give you what we call perimenopausal symptoms. And remember, that goes in with your thyroid, because that lactation period that you did all of that continues keeping that thyroid function lowered, because all that thyroid function's going into your milk and baby and everything else that's needed for your hormones. So go and get some blood tests and ask to see your blood tests. I'll tell you now, most of the doctors are just reading the report that the actual laboratory gave. You could read that report yourself. And if you're ever unsure, you can always ask Pointzy, your local acupuncturist. So this has been me. I'll leave your Mother's Day to you, and thank you for watching if you did. I hope you've had a lovely day, and take care. I shall be back at some point next month. Take care.